Now joining me, our Member of Parliament, Mark Gerresten, on the Skype. Welcome to the show, Mark, and thank you for joining me and taking your time in this trying time. I know you are going through a lot of hard time with your family and you are very, very busy, but I really appreciate it. Was very important for us to have you on and then get the new and updated information. First, before I start, tell me, how's your dad and mom doing it?
Thanks for asking, Jimmy. They're both doing much better now. They're supposed to be released from Trenton tomorrow on Saturday. It was they both ended up testing positive for the COVID-19 coronavirus virus. But the good news is that they both recovered. My father was probably a little bit sicker than my mother was. She pretty much only had a cough, but they've both recovered now, and they're looking forward to coming home. They left on a vacation 5 weeks ago that was supposed to be 2 weeks, and they still haven't made it back home yet. So they're anxious to get home.
He got a little bit more sick because he was teasing Asunta before when she got positive, tested for positive. But anyway, we all prayed for them, and I think the whole Kingston was praying for them. And I'm glad to hear that they are doing well. How's your family and you doing?
Good. We're holding up fine. Everybody is bunkering down in our house right now. We are taking this very seriously, trying to limit the amount of interaction that we have to do outside of our house. So, I was up in Ottawa for that emergency debate on Tuesday and into Wednesday. I came home on Wednesday, and I've pretty much been here ever since at my house. So we're doing well. We're enjoying a lot of time together, but obviously I'm also very busy with responding to
I think this is a wonderful, that's all we can do, and we should do the same. First, I want to thank you for keeping the whole community updated on your Facebook Live continuously and almost every day. People are getting well informed by you and all the other political leaders. The first question I want to ask you, what is the new updates? As you mentioned that you was in Ottawa for emergency meeting. Can you tell us a little bit inside story of the meeting?
Sure. So the big thing to come out of that emergency legislation that was passed by the government is that there's been a new fund that's been created called the Canada Emergency Relief Benefit. And this fund is basically for anybody who has lost their job or become unemployed, significantly had their hours reduced as a result of COVID-19 and the social distancing and everything that comes with that. This is a fund that the government will establish within the next week or week and a half. People will apply for it online, and then the money will start rolling out right away. Basically, the fund will provide each individual with $500 per week for up to 4 months.
Okay. Regarding this, again, I have other question is a lot of small business owner is asking, I'm including there, if we give any of our employees laid off, is that counted as the regular laid off, or is just because of the crisis? Usually it goes on employees file that how many people a year I laid off and how many I hired for any other reasons, for immigration purposes or another business purpose. Is going to stay on our record as the employer that we laying off the people, or is just because of?
So this fund is specifically with respect to COVID-19 and the financial impacts as a result of it. Now, if a small business owner such as yourself, Jimmy, say you have 15 employees and you end up having to lay off 5 of them, well, those 5 can then apply for that benefit from the government to help take care of them while we get through this period of economic downturn right now. But the government did also announce something else earlier today, and that was more specifically with respect to small businesses. So the government is looking to work with businesses that are significantly impacted by COVID-19 and the economic effects of that, and they're willing to pay employers up to 75% of the wages that an employer would be paying to their employees so that the employer can keep them on. We know we're going to come out of this. We know we want to come out of this very strong. We want the economy to just jump back into the position that it was before. So the government is fully willing to put the investments in to make sure that that happens. In addition to that, the government has said that small businesses can defer their GST their GST, HST, some of their any tax owing for a few months to keep the businesses liquid, so that businesses have the cash so that they can continue to keep operating. And in addition to that, the federal government is looking to offer some interest-free loans to businesses as well to keep them going, and there will even be a component of that that will be forgivable. So there is a lot that the federal government has announced today with respect to small businesses specifically, but then there's also a lot that the government had previously announced earlier this week as it relates more specifically to individuals and the needs that individuals need.
Okay. A question I was asked from a few Kingstonians. If I have the opportunity to speak with you, and they asked me to ask you, in this funding coming up from the government, there's a lot of seniors we have in the city and international students.
Yeah.
Can you explain what is in for this funding or the special emergency funds for our seniors and or international students who are living in this country or in the city?
So seniors would fall under a different category, and there is some stuff in there that's specifically with respect to seniors. A lot of seniors rely on, in other than your standard CPP, Canada Pension Plan, and old age security, they rely on drawing money from RIFs or retirement investments. So the government has adjusted the structure to which those need to be retired in order to provide more flexibility for seniors. Obviously, old age security, CPP, that stuff stays in place. When we get to students, it's important to know that the criteria to receive the benefit from the federal government is very easy. There's pretty much three components to it. One, you have to be at least 15 years of age. Two, you have to have made at least $5,000 within the last year. And three, you have to be negatively impacted financially as a result of COVID-19. So a student, for example, who may have worked last summer and made at least $5,000 and had a job lined up for this summer, can say that they were negatively impacted by this, and they can get taken. They can access some of the funding through this special fund that's been set up by the federal government. It's been specifically designed in a way that captures as many people as possible without putting a lot of restrictions in there. And so students, providing that they meet that criteria, will be allowed to apply for it just like anybody else would.
How about the international students?
Well, it really depends on the status of the student, if they're a permanent resident or what it is. So, if anybody
if they have a work permit.
If they have what, sorry?
If they have a work permit, if they're allowed to work in Canada and they were working.
I would have to look into that a little closer. And, I would tell any of your audience or anybody that's watching, if they have specific questions about this or their case is a little bit more unique than the general, contact my office. We're still functioning at full capacity right now. We're just doing it from home, but we're returning phone calls, emails, Facebook messages to get the information out there to people. So if there's somebody with a specific case, contact my office and we'll look into that for them.
Okay, sure. Now we will move on to the other question then. Do you believe or you see the government giving instruction to us as a citizen that voluntarily we should keep our social distance and take all the precautionary measure to stop spreading this COVID-19 thing?
Absolutely.
Have you witnessed that the people are following that one? And if you see that, what is the percentage of the people? If it's not, then where are we moving from here?
Well, it's hard for me to see it because I'm following the directions. I'm staying in my house, so I'm not seeing a lot out there. But I will say, based on polling information and what I've been hearing and what I see people talking about on social media, it seems as though the vast majority of Canadians are taking this seriously. There are still some out there that aren't. But there are some pretty strict rules that have been put in place. If you are coming back into Canada right now, or you have over the last couple of weeks, you are required to stay at home for 14 days. This is not a suggestion. This is a requirement. It's been set up by our federal government and working with the other levels of government. People are required to be there. They're required to stay at home. They do not stop and get groceries. They do not stop along the way. They need to self-isolate for that 14 days. And the reason why, Jimmy, is that this is a disease that and a virus that transmits so quickly. This virus is moving around the globe so quickly, and it's not that our healthcare system can't help people, because the healthcare system really is there and can help people who get COVID-19. The problem is that because it's spreading so quickly, the healthcare system doesn't have the capacity. We don't have enough ventilators. We don't have enough beds. We don't have enough of the infrastructure we need to physically take care of all these people at once. So the whole point to social distancing is not necessarily to stop people from getting the disease or the virus. It's to spread it out over a longer period of time so that people are using those resources over a couple months instead of within 1 or 2 weeks. That's the real reason why social distancing is so important right now. And I mean, I do think that people are taking it seriously. I think there are still some people out there that need to be reminded of the seriousness of it. But I can tell you, I quite often tell people, I hear people say, "Well, I'm never going to get it. I'm healthy. I'm young." People need to be just as much worried about they need to be just as much worried about spreading it as they are about getting it. A lot of people, something like, some of the numbers say 10 times the number of people won't who actually have symptoms will have it and never know that they ever had it. So I could have the virus right now and be totally healthy and it doesn't affect me, but I might go and visit an elderly neighbor or somebody who ends up getting really sick because they caught it from me. So I think that people have to focus just as much on spreading it as they are on worrying about getting it, because really what this comes down to is preventing the spread. That's so critical right now, because as we're seeing in Italy and Spain and coming up in the United States, they say that in New Orleans by the first week of April, they will have hit their capacity in terms of how much hospital space they have and equipment they have. We need to do our work now so that we can save more lives in the coming weeks. And that's really what this is about.
Okay. Another question is related to the people who are coming to this country from abroad. Mm-hmm. I witnessed 2 families came into Kingston, and I heard from them. It was no strict measures at the airport for the screening. They just hand them over a piece of paper which has voluntarily instructions on it that what you have to do when you go home, and one of that, just go to isolations. What do you think the government didn't think serious that we should have strict measures at the airport to screening the people or at the border, or it was just okay to let the people come in and then let them go to isolation, and if they have symptoms, then go to screening?
Well, see, this is the issue, is that there are a lot of people that are coming across the border that have COVID-19 that aren't displaying any symptoms. So I know that the screening, and it's been changing on a day-by-day basis. They've increased the screening and changed the measures every day. So the example that you gave, I don't know exactly when they came, and I wouldn't know what was going on at that point anyways. But what I can say is that, for every one person that's coming across the border that is displaying symptoms, there's probably about another 8 or 9 people that have the virus that aren't displaying symptoms. So even screening techniques wouldn't really, and even if you did say screen somebody and said, yes, you have the symptoms, the vast majority of people just need to go home and stay at home, and they'll get better on their own. But again, this comes back to spreading the virus, and the objective is to prevent the spread of it, as opposed to worrying about getting it. Obviously everybody worries about it, but we have to be thinking about spreading it. And so when people are coming across the border, a lot of seniors who are coming back from being in Florida, and they say, well, I'm fine, I don't feel sick, there's nothing wrong with me. Well, that doesn't mean that you don't have the virus and you're not spreading it. So I don't know if screening measures would have changed the outcome at all. The rule is the same for everybody, whether you look like you have symptoms or you don't have symptoms. The rule is the same for everybody. 14 days in self-isolation. That means you don't go outside, you don't visit friends, you don't have people over, you don't go to the grocery store, you get things delivered. have them drop it off at your front door. This is really the pivotal point in terms of what we will see over the next few months. Depends on what happens right now. And so people need to absolutely take this seriously.
Okay. Let me ask you one more question. What do you see how ready we are in Kingston, and is the federal government have any plan to help the municipality or municipal government in this type of crisis, or will be able to help down the road for the municipality what we will go through in the healthcare system?
Well, the federal government absolutely plays a role in what happens in municipalities, but it mainly happens through working with the provinces. So the federal government's first responsibility is to work on the healthcare issues with the province. And then the province, through our local health regional networks in Kingston, it's the KFLNA, Kingston, Frontenac, Lennox, and Addington Health Unit. They will work together. So the whole network is established between municipal right up to federal and everything in between. What we're seeing now in Kingston, up until a couple days ago, all of the cases in Kingston that have been positive were people who that it could be traced back to either they had just arrived home from traveling, or they were living with somebody or very close to somebody who was also who had just been traveling. But that was up until a couple days ago, and now it's changed, and it's a big change, and it means a big thing for our community. Now, for the first time, they've seen a few cases that are community cases. So this is one person in the community passing it to another person in the community. So this means it's in the community now. So it means that social distancing is even more important now in Kingston than it ever was before.
If I ask you, we are running out of the time because I have Mayor Patterson is online waiting for us. Thank you very much before we run out of the time for all the kind information and your time. If I ask you to give a strong message to the community, what you will say to us as our leader and to us as a citizen, that what we have to do, well, we know that we have to take the social distance and all of the things, but what we have to think really about it to save ourselves and the other people's life.
If you are serious about this and you want to do your part, you have to stay home, because if you stay home, you will stop the spread and you will save lives. And that's what this comes down to. I know it feels difficult trying to be a hero, but by just sitting in your house, but you will be a hero if you sit in your house and you stay home. You can it's literally the difference between saving a life and not. So that's the message, is stay home.
If we don't want to be like Italy or Spain,
Italy or Spain or parts of the US.
Any other country, we have to. But thank you very much, Mark, for joining me, and looking forward to hear from you or continue to hear from you on the live Facebook. I know you will be again on the live Facebook for 5:30. Thank you very much for all the information. Please stay safe, take care of yourself, your family, and send our prayers to your parents and your loved ones or anybody infected in your circle of friends. Thank you very much, and I'll see you next time.
Thanks, Jeremy.
Thank you. COVID-19 is not just a health issue. It is an economic, community, and social issue. Now is not the time to turn away from one another, even in quarantine, because at the end of the day, any of us can be infected or lose someone else to the infection. So please stay safe, stop spreading, save the life.